Right, Madam Zuma, thank you very much for that inspiring talk, and I think you've alluded to a lot of issues that affect everyday lives of every single person in this room. They might not be really attuned that it's really affecting our lives in the sense that you've spelled it out for us. And just to reiterate some of the figures that you've given us, it's a fact that at least 1 in every 6 South African men, 1 in 7 South African women will get cancers in their life. That's a fact. And I think the question I would like to start off with in our discussion, and I'm going to try and make the session quite interactive, so we're going to have a little bit of a discussion, we're going to open it up for questions in the interest of time as well, is that we've been very successful, as you alluded to, with the HIV story. I just want to say you shouldn't forget the African potato, which was also on the agenda at that stage. But it's wonderful news that that has been taken off the table, and we had a very proactive approach that in our age groups, 16 to 24, we've got no new incidences of HIV currently. It's really stabilized. Our mother-to-child transmissions is really at a zero base. Wonderful, wonderful work that has been done. The question I would like to ask is, how do we get that same momentum with a big challenge related to cancers in our country? Because as I've alluded to, and you've highlighted in your talk as well, is that it doesn't seem to be a topic of discussion as much as we would like it to be. And I think one of the key aspects I would like to start our discussion with, and you've alluded to in your concluding remarks, how do every single one of us in this room become an ambassador to drive the healthy message? Whether it's cancers, whether it's NCDs, we're focusing on cancers here tonight. But the important issue is what's the little things every single one of us can do to drive that healthy living message, to terminate or to reduce our burden of disease in this country.
No, thank you so much for the question. I think what I learned when I studied in the cancer landscape was that so many of the organizations were working in silos, and there wasn't a coordinated approach in ensuring that our NGOs are working together under one umbrella. And when I zoomed into it to really try and understand why so, the reason I found was that it's because of the competition which exists for funding. And I think for me that was the major or the main reason why our NGOs were working in silos, because you often find that they all deal with the same cancers, but they're going different directions. And I think during my speech, one of the important message that I had was that we need to work as a collective. It has to be a coordinated approach in that all the relevant stakeholders work together. We need you, the universities, for research. And also, when I looked at, the research space, it was also, there wasn't a body that was there where all the research institutions were working under. So it was also a situation whereby they're working in silos. But coming back to your question as to how can these messages, as individuals, be taken out there, I think for me, we are very fortunate that this day and age, there is something called social media. I think for me is the most powerful tool that we cannot even begin to underestimate its power. Social media also for me is very cost effective when you're talking NPO space. So if we take advantage of social, you see the problem is social media, and I've often said this to our students, because we also targeting as the foundation grade 8 and grade 12, because that's where often things go horribly wrong before they even get to varsity. And I said, social media is no longer used for the purpose which it was established. It was intended for dissemination and sharing of information. It was not used for blind dating. It was not used to post people's pictures naked. And that is why we see our kids being kidnapped. some of the cases originate from social media, from your Facebook, wherein they start dating. The child doesn't even know the person, but they met through social media, and when they eventually meet, the child gets abducted, the parents don't know where the child is. So the social media, my understanding when it was launched in New York, I was there, it was intended for disseminating information, sharing of information, a tool to be used to share the knowledge and information. So if we can take advantage of social media, but also the word of mouth is very powerful. For me, I don't even wait to get to know you. When I'm on the lift or if I'm sitting on the plane, I would ask you whether you're a man or a woman, and I would say, has your mother gone for screening? Are you aware that there's cervical cancer? Are you aware that there's breast cancer? Or are you married? You know, I remember I was going to Cape Town and this gentleman blushed and probably think, oh, this woman, there's something wrong. And I said, are you married? And I said, the reason why I'm asking, say, by the way, just to alleviate any fears, it's because I want to know whether you have, your wife has gone for screening. So for me, that, but also in the healthcare centers, you know, the foundation was very fortunate, you know, to partner with the private sector through public-private partnerships. And we were able to build or create a high care ward in Charlotte Macquarie. The public hospital with large volumes of cancer patients going through. With large volumes of cancer patients going through to Charlotte Macquarie, and being the public hospital and the only public hospital in Greater Gauteng, we said we were looking for existing beds. So we took what was a waiting room, we converted it into a cancer high care oncology ward for cancer patients only. Why? Because we're informed by the fact that when our cancer patients experience things like relapse and what have you, the doctors often in the general hospitals, they are faced with the competing or the shortage of space in the high care wards. So we said this one will service the cancer patients only, but for us as the foundation, we said we need to have the educational component in it. In that, we need to then have TVs where we can put up DVDs with the information that will empower our patients, but over and above that, printed material in local languages, because otherwise then we wouldn't be able to communicate with people if we don't use their local languages. So those are some of the interventions as the foundation that we have done in ensuring that we get the information out there.
Thank you very much for that. I think you've also alluded to the point that universities have got a responsibility to do research and work in a coordinated manner. But I would like to ask Ms. Bayat opinion. I think as universities we also have a responsibility to train people to understand the dynamics within the country. You spoke about the urban-rural divide, where people in a rural environment has got to get permission from a husband to go and see a specialist or a doctor or a healthcare worker for another man to touch his wife type of scenario. Are we sensitive enough in those type of issues in our training of healthcare workers? Because we train brilliant clinicians, but the social determinants of health is a very important aspect. And are we training sufficiently around that domain? Just your personal opinion on that.
Good evening, everybody. I am a lecturer in the Department of Medical Imaging and Radiation Sciences, and I'm a lecturer specifically lecturing in oncology. And we do kind of do sensitize our students to that concept, because one of our modules that we do give to our students is psychology, and that forms all part of it, where they have to be sensitive about such issues. That's just one issue. There's so many other issues. So we have to make them aware of it, and that's where counseling also comes in. So it really plays an integral part of our curriculum and what we teach our students.
So we've also seen that 90% of all cancers is formed by environmental and lifestyle factors. I mean, you've alluded to the fact that we only know around 30% of the causative agents, and you've highlighted to the facts of smoking, diet, and exercise. Do we have enough positive messages out driving those issues? Because as a norm, is young South Africans, are they healthy enough? Are they taking proactive action around these issues? Before we get to some of the real issues, and I just want to spend this as an introductory part, and then we'll talk about the real issues around breast cancer. It's a real problem in the country, cervical cancer. So as the youngsters in the room are just attuned to some of the issues and regular testing and monitoring around these issues.
I think that's the reason why, it's one of the reasons why we exist, to encourage our people
My mic apparently works better. So let's just use the mics in the interest of time.
Yes, I think it's through our messages that we encourage people. I think recently we had the Warriors Walk for Cancer in Pretoria, which was the first annual Warriors Walk for Cancer. And for me, there it was not only to honor those who have lost the battle and those that have survived, but also to encourage our people to try and follow some fitness routines in their life. And I must say that that becomes a bit of a challenge when you go to the rural areas because of not having, places where our people can exercise. Although rural development is now driving and through sports facilities as well, they're driving the creation of areas where our people in the rural areas can exercise. But also for me, I think apart from exercising, there are many other things that we can do. Eating healthy. I did say that once you commit to it, it's a decision that you've got to take and stay committed. I can educate you to eat healthy, but what you do thereafter is another. So it's very important that when we drive our messages, we try and drive balanced messages in that if you can't exercise, at least this is what you need to do. Eating healthy is one of them, because what you put in is what you get out, is one of the things that I passionately drive and emphasize in that even when you're in the rural areas, when we empower our people in the rural areas, eating healthy is not that expensive in that if you eat green and you plant vegetables, you end up sharing the land with your neighbors because they've got this natural resource that they can make use of. Plant vegetables, try and eat healthy. If you look at how our grandmothers and our parents, they lived longer, owing to the fact that they used to eat healthy. And they would eat homegrown chickens as opposed to the chickens that we now get in the supermarkets and that we buy from the shops. They would eat green. They believed in eating green. And that is why that's one of the major contributing factors to them living longer. So I don't know if I've addressed your question, but we through all the means, unfortunately with our media, I must say that, unfortunately for our media, we cannot take full advantage of our media, print media in particular, in ensuring that we can get these messages out there, because often media is driven by sensation. So what sells is the stories that create sensation. So if you come with a story to say, I need to empower people and tell them to eat healthy, the story will probably be in page 16 and 17, and highly likely that our people may not see it. But we also still continue to call on our media to say, can you be our partners? Because we need the very platforms to ensure that we educate our people, those that have access to print media. But we, through the radio stations as well, we've got partnerships, meaningful partnerships wherein we empower our people, not only during the months when we celebrate these, when we highlight the dangers of these diseases like October, but we do it on an ongoing basis.
Just before we open up to the audience for questions, we'll take 3 or 4 questions from the audience. The major cancer in South Africa related to women is breast cancer. And I think many young females do think it's a problem I have when I grow old and I'm above 40, I'm above 50. And we do know that at the age 50, you've got 1 in 6,000 chances to get breast cancer in South Africa. By the time you become 50, you've got a 1 in 600 chance, 10-fold increased chance. But significantly talking about healthy lifestyles, is that studies has proven that ladies, young ladies that have at least 2 drinks, alcoholic drinks every single day, increase their risk to get breast cancer by 24%. So it's a significant issue. Ms. Wyatt, I think just the important aspect of being aware, even at a young age, about routes that I could follow for screening, for awareness-related issues.
You know, it was said earlier that cancer is on the increase, but we must just realize that actually the mortality has decreased. And the incidence of cancer has increased because of our screening that's available out there. And that is one of the major things that is needed to detect early cancers, because we want to rather detect them early as opposed to later. We are going to save lives by doing these screening procedures. So basically, it is very important that all females have the mammograms annually. It is very much age related. So with that, you know, there's many things that put you at risk of getting breast cancer. One of them is hereditary, meaning that if your mother or your sister has cancer, it puts you twice at risk of developing cancer than somebody that hasn't got a family history. So for that particular lady, she should actually start having a mammogram from the age of 35. It is recommended. Then, if there is no family history of cancer, breast cancer, then ideally from the age of 40. It is, but some people recommend that it should be done annually. Some say every 2 years. But definitely, because as you age, there are hormonal changes. There's so many factors that increase your risk. Like something, if you menstruated before the age of 12, it puts you at risk. If you have late menopause, that means if you go up to menopause till the age of 55, above 55, it puts you at risk. So there's so many factors, and therefore screening is really, really important, because we want to detect any changes at the earliest stage, because the earlier we detect it, the better we can manage it and we can cure patients.
The University of Johannesburg. Rethink, reinvent.